Capitol Hill now, where the House narrowly passed a Republican-backed health care bill, which does not extend the soon-to-expire Obamacare tax credit. Speaker Johnson did confirm that in January, the House will consider the Democrats' successful discharge petition to force a vote on extending those tax credits for 3 full years. 4 House Republicans broke with their party and signed on to that discharge petition. Pennsylvania Republican Congressman Ryan Mackenzie was one of them, and I spoke to him earlier today. On the topic of soon-to-expire Obamacare tax credits, Congressman, what's the state of play?
Well, I think right now what we are looking for is not only a way to provide short-term relief to Americans who are struggling with the high cost of health care. At the same time, we would like to see reforms that can bring down the cost of health care in the long term. And so we have offered 2 bipartisan packages. They have discharge petitions at the desk that we could be voting on. But because we did not get Democrat support from Leader Jeffries and his conference on those, we had to go a different route. And so we signed on to a discharge petition, which is just a 3-year extension of the tax credits. Hopefully, as that works its way through the process, we can add additional reforms, because we've seen that that proposal alone did not get the 60 votes that it needs in the Senate. It failed over there previously. So again, we're looking to continue this conversation, because we know so many Americans are looking for affordability and relief in the cost of health care.
Congressman, to be clear, the House will not vote on that discharge petition this week or this year, will it?
Yeah, we were looking for a vote. That's why we've signed the discharge petition. We think that a vote should be coming. What we've seen is, again, there are going to be ongoing conversations. If anything does happen, you're going to see likely an extension of the enrollment period. And I know some people in my local community have seen price spikes already from the cost of health care. They've decided to go without health care in the interim, and they've said, hopefully Congress is going to sort this out, and then I can re-enroll. So we do need to do this as quickly as possible. But at this point, with the Senate where they are and a lack of consensus on a compromise package in the House, we aren't able to get anything done. And I think what is really clear that we should also speak to is that we want to see long-term, durable health care reforms. And the way to do that is in a bipartisan fashion, because why we're in this situation is because we had a totally partisan Affordable Care Act, an extension that was done in a purely partisan fashion by the Democrats. And then when there are changes of power, which naturally occur over the years, the next party in power has a different opinion on it. But if you can actually do something in a bipartisan fashion, that way whoever is in charge down the road, there will be advocates in that majority conference, and it's more likely that those changes stay in place. So again, I'm confident that we can actually do it, but the discharge resolution that we signed was the only path forward at this time to continue these bipartisan conversations that I've been a part of.
Have you been penalized in any way or criticized internally within the conference for signing that discharge petition? It's a pretty bold move. Not everyone does it.
You know, I think there are certainly some members of our conference that have spoken about their displeasure with the approach that we've taken. But I just spoke to a member on the floor today who is very opposed to the 3-year extension. And I said to him, this is something that is very important for my district. And I gave the example of a small business owner, a restaurateur, who is going to see his price go from about $400 up to over $900 a month for him and his family. Unsustainable. He said he's going to de-enroll and wait for some change down the road. That gentleman that I talked to on the floor said, you know what, I understand where you're coming from. And he said, if we can do a shorter term extension plus some meaningful long-term reforms, I think we could actually find a middle ground. And so that's what we're trying to do. I get that it was an uncommon and unnecessary approach that was taken this time, but we had to, because there was no other opportunity in front of us, and so we had to go this route. But I think it is actually starting to force conversations between not only our conference, but in a bipartisan way as well.
Do you fear any retribution from House Speaker Johnson?
Well, I think that it's very clear. I mean, Speaker Johnson and I have a great working relationship. He understands that I'm sent here to represent my district, and I'm going to do that every single day. And he's very understanding of my concerns and my considerations for our local residents. So I think he understands the dynamics. Everybody across the country should do that. They should represent their district, and he understands that. And that's what a good speaker does, is their understanding of the different nuances of individual members' districts.
Your move and the move of 3 other Republicans onto this discharge petition promulgated questions for the Speaker yesterday. Has he lost control of the House? Has he?
He is not. And I talked to another member on the floor, again, somebody that was opposed to this, and I said, we all voted for this same set of rules that allows 218 members. Sometimes it's going to be lopsided one way or the other. Sometimes it's going to have a more even balance to it. But that is a part of the rules, and that is something that Speaker Johnson signed on to as well. If we believe that there should be a different approach that gives more control to the Speaker in the future, that's something that we can certainly consider in the next set of rules. But this is something that the Speaker voted on. Members of our conference voted on these rules as well. So I don't think he's lost control at all. In fact, I think he is living with the rules that we all voted on and we supported at the beginning of this Congress.
You talked about the need for bipartisanship on health care reform. The president has advocated again and again for giving money directly to individual Americans through health savings accounts. Democrats call that junk insurance and a non-starter. Is that a path to bipartisanship?
So I think it should be one alternative that is on the table. What you see with all of these different proposals that are out there is they are going to address certain components of healthcare costs for Americans. And so by putting money directly into an HSA account, that could do things like help offset costs of deductibles or copays that an individual may have. So I don't think we should exclude that and say that that is not a potential part of the plan, but I think we do want to see larger reforms beyond just that.
Republican Congressman Ron Mackenzie of Pennsylvania, specifically Allentown, Pennsylvania. It's been a pleasure. Thank you, sir.
You got it. Thank you, sir.